We are going to talk a little bit about throwback history here, and we are going to travel back to July of 1970 in New York City. The Young Lords' occupation of Lincoln Hospital. The 1960s and into the 1970s saw a radical shift in consciousness for American youth, particularly in the inner cities of the nation. Oppressed Americans, mainly minorities across the country, took to the streets to protest against the injustices they faced. The public health violations in Lincoln Hospital were among these injustices that often led to medical complications and even death for primarily Black and Latino New Yorkers. The Young Lords, a radical civil rights organization comprised of mainly Puerto Ricans, took over the nurses' residence building at Lincoln Hospital in July of 1970 in an attempt to bring light to the maltreatment of oppressed New Yorkers. Although controversial, their actions were essential for the improvement of the hospital and the community around it, as it caused the city to refocus its priorities regarding public health. The health needs of Black and Latino New Yorkers living in the slums were not treated as a priority for the city officials in this era, or ever, in any city, in this country. This country does not care about poor people. Prior to the Young Lords' public health activism between 1969 and 1970, the members of the NYC Board of Health did not classify renovations of residential buildings to prevent lead paint poisoning as a real health problem. Lincoln Hospital had been notorious for neglecting its patients, especially for causing its child patients to receive lead poisoning. One of the breaking points for the Young Lords was the death of Carmen Rodriguez at the hands of the hospital's own negligence. Rodriguez had sought an abortion at Lincoln Hospital. Once a drug addict, she had suffered various illnesses that afflicted her and many in her community, like asthma, anemia, and a severe heart condition. The doctors never bothered to check her medical history chart and administer her drugs that could not be given to patients with heart conditions. As a result, she died 3 days later on July 20th, 1970, at 31 years old. Furthermore, lead poisoning in children had become an epidemic, with 600 cases being recorded in November 1968 over the course of 10 months, 3 resulting in fatalities. This occurred even though lead-based paint was banned in residential buildings in New York City in 1960. The Young Lords and other Black and Puerto Rican New Yorkers who had suffered health complications due to the city's negligence decided that taking matters into their own hands was the only way to get the city's leaders to address the life-threatening public health crisis. In July of 1970, the Young Lords decided to take control of the crisis, threatened with budget cuts. The hospital had been known as the butcher shop by local residents for its ill treatment of patients. Joined by the Health Revolutionary Unity Movement and the Think Lincoln Committee, the Young Lords occupied the hospital for 12 hours and demanded better health care and hospital services to the people of the community. Among the demands were no cutbacks in services or jobs, free food and a daycare center for patients and their kids who wait hours to be attended, construction of the new Lincoln Hospital to be completed quickly, and the immediate formation of a community worker board to control the policies and practices of the hospitals, like door-to-door preventative care emphasizing lead poisoning, anemia, drug addiction, and tuberculosis. The Young Lords negotiated with the hospital's officials and other representatives of the city's Health and Hospital Corporation. However, after the negotiations were made, a police officer disguised in civilian clothing had allegedly tried to seize one of the members of the Young Lords, resulting in the negotiations being called off by the party. Around 5:30 p.m., the Young Lords removed the Puerto Rican flag, which they had hoisted over the building, and filed out peacefully. 2 members, Pablo Guzman, the Minister of Information, and Luis Perez, his bodyguard, were arrested as they left the building. The Young Lords' occupation of the hospital dramatized its disastrous conditions, but placed the crisis into the political spotlight of the city. As a result of their takeover, over 100 news articles reported the controversies over the hospital's conditions. City officials were pressed to meet these demands, and eventually the takeover gave way to the passage of anti-lead poisoning legislation in New York in the early 1970s. Later that year, they launched the People's Program at Lincoln Hospital, which was a methadone detoxification program run entirely by volunteers. The Young Lords' demands gave way for significant improvements at Lincoln Hospital, since it was the only source of medical care for many South Bronx residents. Most notably, the hospital was scheduled for renovation over 20 years prior to the takeover. Yet it was only after the Young Lords' activism did they accelerate its reconstruction and eventually opened a new Lincoln Hospital just 6 years later. Although there is still much to do in improving public health, the Young Lords paved the way in not only raising awareness to a critical situation at Lincoln Hospital, but directly attempted to aid the community of neglected New Yorkers. Due to their efforts against public health injustices, the city began to prioritize the medical necessities, especially the lead poisoning crisis that was prevalent not only at Lincoln Hospital, but throughout Black and Latino communities. Ultimately, their activism should not go unnoted because their selfless action proved to be momentous for thousands of New Yorkers. So this is from Page and Brew College, basically. The history of health in New York. Why did I want to talk about that? Well, two things. Number one, the healthcare system in this country is probably worse off now than it was in the 70s, if you could actually believe that. And two, we are in dire need of something like this to be happening on a bigger scale. This is a great way for an outsider strategy to helping demand changes in our healthcare system, to helping demand a Medicare for all system, an overhaul of our medical insurance and medical tech and medical care and hospitals. One way you could do that, why don't we just organize and go in and take over the hospital? I'm pretty sure the movie was John Q back in the day, where Denzel takes over a hospital with a gun because his kid needed a heart transplant. Why don't we do that without the guns? I mean, by the end of the movie, he has patients and doctors held hostage, and he starts forcing the doctors to triage and perform their tasks and duties based on necessity and not based on wallets, not based on who can pay, but based on who needs it. It's kind of ridiculous. That movie is actually really good. Everyone should watch it. I haven't seen it in, over a decade, and it still is emblazed in my brain. We need more people to pull what the Young Lords pulled in the 70s.
What's the matter? The CIA got you pushing too many pencils? Huh?